Hey everybody, it's Khara CrossFit Brindle. Welcome back to the channel. We have Liliana back. Hi Liliana, how are you today?
We're good. I hope that everyone listening is good too.
Yeah, we're gonna do our best.
We're
So
going to,
obviously you wanted to do a video and I really appreciated you outreaching me. I'm like, we need to talk about this. So I put out this report for adverse psychological events, so APEs, for folks who've been tracking kind of the social media presence and the things that we put out. APEs are adverse psychological events in mental health. So things like client suicide, client death, grievance, subpoena, and client violence directed towards us. So this is something I just put out a report for 75 participants. You and I were like, this is really interesting. A lot of the folks in the report are Colorado clinicians.
yeah.
So talk to me about your first impression when you saw the report when I sent it to you.
Yeah. So one after I read the report right away, right? I was like, that's information that we know. And when we tend to minimize it and talk about what is the life expectancy of a seasoned therapist. And I love that now you have data to say this is why most people get to
Mhm.
retire. And then I think because I was reading it, I started thinking of how do we normalize that we hold so much by being available to our clients. And then we don't think about ourselves as humans. Alex Castro is not here for all of you who tend to see this, and he tends to talk a lot about humanizing, right? So, in honor of him, we will say, what can we do to humanize those experiences so that we shift the conversation of we know this is what we do, but how do we take care of ourselves? And that's what I was thinking when I was reading your report, which is what can we do to talk to the community so that we change the way we see ourselves, such as we're just here to serve.
Yeah,
And how do we switch it to how do we take care of ourselves so that we can show up for others?
absolutely. So yeah, I mean, I think most of the data didn't surprise you and I because we've been tracking this as mental health leaders for a few years now, actually. We've had the conversation of APEs way back, I think even early 2023, actually. So for folks who haven't seen the report, I'll definitely link it below. But I think some things to call out from the report include almost 50% of our 75 respondents thought about leaving the field, much to what Liliana just shared, right? So it's like, I think it was 46% are like, I considered leaving the field. They're still
Mhm.
here, which is something I think we'll continue to flush out as we collect more data of like, well, what allowed you to be here? Was it leadership? Was it resources? Was it grit and resilience? Like, what allowed you to stay in the field? Most of those folks were Colorado because that's our pool of people. That's our community. So that doesn't surprise me. But I think the thing that surprised me the most that I wanted to talk to you about on this video is we saw a split in how long the symptoms of these events lingered. So in my research prior to doing this, I had seen specific to client suicide that 3 to 6 months of PTSD symptoms was normed. Like that was the normal. In our data for all five of the APEs, it looked like there was a split of 1 to 3 months of symptoms and then 2 to 5 years of symptoms. Like that was kind of the breakouts of 20%, 20%, which I find
Mhm.
wild. What are your thoughts on why that's happening?
Even when you were saying that, right? I was like, we all read uh the book. I'm doing this because I always get that. But the body keeps score, right?
Yeah.
So even when you were saying that, I was like, how is it that we read for our clients, but we don't think about how we hold those symptoms
Mm-hmm.
in our bodies as professionals? So even when, when you were saying those numbers, I was like, yeah, I mean, we were told in the body keeps score, yet we don't integrate it that way. So
Mm-hmm.
today, I think for us talking to everyone who's listening today, everyone who's a professional, is can you think about what you're reading and the impact that it's having when it comes to how long the symptoms stay with you, even from that book, or when we love to talk about burnout,
Yeah.
how it makes sense. Like, yeah, because of everything that we hold, right? And so let me pause that. That makes sense? Like automatically when you were saying that, I was thinking of that book. Let me pause
Yeah.
here. What do you think of that as soon as I said that?
Uh, I mean, I thought that book is so damn long, if I'm being honest, which no one's going to be surprised of like when you're like read, I'm like, yeah, like skimmed, like didn't probably get through the whole book because it was so much content. But I
Yeah.
think the concept of we hold on to things is not surprising, right? Like we know that this shows up in somatic complaints, this muscle tension. I've written books on how it might have an impact on our thyroid and seeing that in women as professional helpers. So like I already knew that because of my lived experience. But for people watching, they might be like, okay, yeah, there's like some long lasting effects of holding on to people and their stuff. There's a YouTube video. I'll try and find it to put below this video, but it was like a video of like kind of taking a black sludge out of somebody else, like out of empathy and compassionate listening. Like we would like absorb like a sponge. They're heavy,
Mhm.
and then we would turn dark color, like gray or black, and like have all these like things inside of us. These are like little stick figures
Oh, I
for people who want
remember
a
that one.
visual. And then like and then it showed like we would offload that tar or blackness onto something else. Like we would pet our dog and it would disappear. Or we'd like release it into the wind. And that's, I think, symbolic of coping skills. But that doesn't mean that there's not still small little granules of that black tar somewhere in like behind my heart. Or someone said like just check the soles of your feet for IFS, right? Like it's still there, but it might not be
Yeah.
like all of me. And so as you're
Mhm.
talking and we're talking together today, I'm like, well, maybe we're doing a decent job of offloading the bigger pieces, but maybe there's some subtle stuff that's still there. What do you think?
So it is, right? So this is where the somatic exercises coming in place. This is where your own therapy, and when you talk about resources, like what are your resources? What is it that you're doing for self-care, not in the aspect of what we've been told, which is go get a massage, go get a
Right.
pedicure. Those are lovely and they're privileges, which not everyone can do, especially if you're
Mm-hmm.
starting, right? If you're working towards licensure. I mean, I remember you and I remember the pressures of it. I truly believe that this is where what is it that we're doing because we tend to go numb when we are holding all these little pieces, even when you're walking, even when you're eating healthy, per se, even
Mm-hmm.
when like, you're doing all the right things, there's still some residue left behind. So then what can we do to somatically move that and then also put boundaries on what you do so that you're not always just adding in, right?
Mm-hmm.
That's what I was thinking when you were talking about it, either IFS, when we're talking about parts, or somatic, which is where in your body are you noticing that? When you think
Mm-hmm.
about the last session, think about where in your what part of your body reacted, and then are you even aware when you went numb? When we
Yeah.
as professionals tend to normalize the pain and the trauma that we work with because it's part of our daily take. So when you were mentioning that video, because I do remember that one, I was like, yes, which I feel bad for the dog, by the way, when they touch the dog
Because
and
the
then let
dog took
go.
it. Yeah.
I was like, I don't want my dog to have it.
Right.
But what is it that we can do so that is this continuous cycle going so that we're not just holding it in?
Right. Right. And so like the burnout book of like complete the stress cycle shows up in my head of like you shake it off, or like after a heavy session, are you stretching, moving, getting water or something? Like you're not just like going to the next client, like having some intentionality between sessions could help not let that land for very long if needed. So I feel like there's lots of conversation we could have around that. For listeners or viewers of this video, obviously, if you're in the thick of this, this is something we want you to be curious about. If you're a mental health leader, we also have some thoughts for you from this report and ongoing data that I'm collecting. How would you put this into words, the thoughts we have for mental health leadership?
Uh, I'm gonna, when you say leaders, I was like, hmm, let's reframe it,
Good.
Lilian.
Let me censor myself a little. No, I'm just kidding.
Actually, that's what it is, right? Can we start thinking about not just clients and not therapists as a tool of a means, which is usually tends to comes to finances, like how many clients can you see so that we can sustain? Can we see therapists as humans? Can we see therapists as humans who are containers of every all the stressors that they're dealing with, all the trauma that they're dealing with as leaders? And can we shift the conversation from how can I show up for you today? What do you need from me today?
Mm-hmm.
So that we can take care of the therapist, so that the therapist can continue taking care of clients, so the clients can continue taking care of whoever they're taking care of, right? So the idea of modeling from leadership um, down below is what can I do to show you a different way to take care of you?
Right. And I don't know the direct quote, but I think there's a quote like, great leaders lead by example versus I don't know what the other part of that quote is. Because I'm like, no, the important part to remember is lead by example, not do as I say, not as I do kind of thing. But like Simon Sinek, who I'm a huge fan of, like would say that, right? Like leaders eat last, like we make sure that our people are taken care of. And so my hope with reports and conversations like this is that we are like creating some curiosity in leadership of like, what can we change? Does this reinforce the 7 year, average for people in our field? Does this change how we want to show up in grad school with self-care and the programs that are being built? And I have a whole conversation about that we talked about offline of like that could be so much better. So my hope is this report is going to start conversations. We've obviously had one today, but maybe people are going to take this back to leadership or say, hey, as an agency, how can we change some things based on what we're seeing? As I alluded to, this report is like not one and done. I'm going to keep updating it as we get more data. At the time of this recording, we have 90 participants in the survey, which is heartwarming and heartbreaking that we've got 90 people that are like, yes, I've been through at least one of these adverse psychological events in my career so far. And I truly, in my gut, my intuition says why they're still here is they had emotional and community support. And so I don't know if that's leadership. I don't know if that's colleagues like Liliana, you are to me. But my hope is we can start to say, how do we have that human conversation first, not just the cover your ass, let's talk about how many clients you saw this week kind of thing. Final
Yeah.
thoughts from you on this topic for today.
And I was saying my hope with this report and the ongoing of this report is that we as professionals start talking about our shared experiences with being containers of trauma, that we
Mm-hmm.
start talking about the stigma that comes with it as being professionals and having to know better because of what we do. And then that from leadership, that we don't continue with this idea of projecting what I learn and what I normalize, which is, I think that's what happens with systems. This is how things are done. And therefore, this is what you need to do so that you can pay your dues. Can we
Yeah.
change that so that we take care of each other because we're needed? There's a shortage of therapists, like we are needed. So can we remove the stigma of us being humans and having to deal with, what it is to carry trauma because we're showing up for others?
Mm-hmm. Yeah, absolutely. As you're speaking, I'm hearing Alex's voice in my head saying synergy. There's some things that are popping as we're talking today about like, oh, this is where this is going to go. This is how this is going to change things. Because there's still so
Yeah.
much heart behind the data, right? The data might speak to people that I haven't been able to reach or that we haven't had conversations with yet. But I think there's a lot of people in the trenches, for lack of a better word, that are like, yep, this totally tracks. This is what we experienced. So not as much of a news flash for them, but maybe for leadership, it'll make a difference, change some things. Liliana, thank you for always supporting my projects and the fact that we're both trying to move mountains down the road when it comes to leadership and therapy. I appreciate all of your insight as always, because I think this is a necessary conversation to have and to keep having. So thank you for joining me again on the channel to have this conversation today.
And thank you for doing this study and for pushing the system in a different
Yeah.
direction.
Challenge accepted. Let's keep pushing the system. A little bit, it's kind of fun sometimes. It depends on the person. But as
Yeah.
I named for viewers, we'll put the links below. I'll share the report if you haven't seen it so far. I'll try and find the video that Liliana and I have talked about with this like black and white image and gray tar and all the things if you're curious. But let us know your thoughts. Comment below and let us know how you're doing with things. I'd also love if this does resonate with you to share your experience in our anonymous survey. We're trying to collect as much data as we can. I would love to get more people of, kind of new to the field, but also people in different states. I think we're up to 14 states and Canada in the survey so far. And I'd love to see that reach even further. Because yes, Colorado is where we live and where we love to be, but I think there's also some data that would speak to other states here too. So thank you for joining us. Stay tuned for more videos. We'll see you next time.